So let's talk about neck mechanics and how it should work when you turn your head. So I'm gonna have Justin here, he's gonna stand facing me. I want you just to go ahead and look over to Phil, but I want you to do it as if you were all locked up. What would that look like? Yeah, so see how he kind of comes off axis and he tilts back this way? This is what we see in a lot of our patients. It's usually indicative of the upper cervical spine, not like those top two vertebrae, not rotating the way they should. So whether there's a stiffness up there or just poor motor control. But what that does is it typically ends up kind of wearing down some of these joints in the middle, and we just overuse them because we're using them wrong. You're not supposed to do that. The top ones are supposed to rotate. So a lot of times with somebody like him, I'm going to have him now here, but we're going to face the mirror because I want him to see what he's doing. Nope, sorry, still facing me, but go ahead and look towards the mirror. Oh, okay. And go ahead and look towards the mirror. And if he deviates off to the side, can you see how you're tilting back this way? Okay, now the goal would be to see, can I keep his chin, nose, and forehead vertical as he's doing this? So can you do it? Oh, okay. So he's staying a little bit more vertical. Is that different for you?
Yes.
Yeah, it feels different. It's like a little bit harder to kind of get into those positions. So it's nice just being aware that you're doing this. Most people don't even realize they're doing it. So we can retrain that too. So Justin, I'm gonna have you come on down here and take a seat for me in that cross-legged position. Butt all the way up against the wall. And I want 3 points of contact, kind of your butt, back of your shoulder, back of your head against the wall for me. And it's kind of sitting up nice and tall. And this time what you're gonna do is you're gonna try to stay nice and tall through your spine as you rotate over that left side. But you're going to try to keep some part of your head against that wall, if that makes sense. So he's trying, ooh, there you go, tuck that chin for me just a little bit, good, and then come back to neutral. So we're also trying to keep him from like pushing back and into the wall. And can he stay there? And almost like there's a spot right behind his head that as his head turns, it's going to spin right on that spot, if that makes sense. Good, okay. How about can you come back the other way? Go to the right this time. This is a good little drill to do at home to practice and see how that feels. It might feel a little artificial because you're not used to propping your head up against a wall as you rotate your head typically, but it's a good little drill. Great, then come on back up. Let's go ahead and do it in front of the mirror one more time. And so now that was like some proprioceptive feedback to do it against the wall. Now he's going to get some visual feedback to see if he's doing this correctly. So now go ahead and go over to that right side for me. Good, how's that feel?
Good.
Yeah, kind of nice? It always feels better to do it right. But again, that chin, nose, forehead vertical is indicative that you have good motor control through your neck stabilizers and all those little tiny muscles back there that do turn your head, and that all those joints are healthy and doing their job. That's huge to kind of keep you out of neck pain and keep you functioning really well, seeing over your shoulder, especially changing lanes and driving and whatnot. Another big part of this is we always keep him to get up nice and tall because that's going to put his spine in the right place so that his joints can do their job in the intended position. Okay, so a couple things to think about. Get in front of a mirror and see, do you deviate to one side or the other? If you do deviate, find a wall, try that drill that he did, and then come back and check it again in the mirror and see how you do.